Hello, and welcome to the Small Business Sweet Spot. I'm your host, Barb Davids, and this show is dedicated to helping small business owners like you get more organic website traffic, and also to help create and distribute content and analyzing the numbers so that we can make better informed marketing decisions. It is action-oriented, direct, and conversational. I'm so glad you're here. Let's go. Thanks for joining me today, Harlan. I really appreciate it. I'm going to say this, super excited because this is a topic around something I know nothing about. So thanks for sharing your time today.
Absolutely. It is my pleasure. It was great to have you as a guest on my podcast here a couple of months ago, Barb.
Yeah.
And I thought we had a great connection then with you sharing what you do. And I certainly appreciate you asking me to come on and share what I do.
Yeah. All right. So I'm going to let everybody in on what is going on. This topic is around health insurance. And in particular, just as a reminder, the audience is more small business based, freelancers, people like me. So this is going to be very interesting because I'm going to admit something. One, I don't have insurance. And two, and you're going to laugh at me because I know that there's some people that think about this, and I've seen some articles, but I don't get sick. And I know everybody's like, oh my God, what if something catastrophic happens? But I don't get sick, and I am very lucky. I'm very grateful, and I have been healthy most of my life. And I went to the doctor one time a few years ago, and they told me something with my liver number was high, and I never went back. So there's that. So everything around the health insurance, I'm pretty excited to talk to you about and just get educated on it. So I think this will help other people as well.
Well, what you just said is not something I never hear, right? I mean, I hear this all the time, right? Well, why would I have it? I don't get sick. And so let me put one myth aside real quick, and that is to receive health care, you do not have to have health insurance. Okay. So many times we are told, even by the government, right? I mean, they even made it a mandate at one time where you had to have health insurance or else you got fined. But health insurance and health care are two totally different things. And in many cases, you actually can receive better health care by not having health insurance. Now, how is that even possible, right? Well, think about this. Health insurance companies typically determine which doctors you can go to, right? Who can you go see because you have a network? They determine which referrals, right? They determine which facilities you can go to because they have to be in the network. And then they determine whether you can even have it or not. You and your doctor may have decided you needed a certain surgery, a certain procedure, a certain medication, and the insurance will come back and say, nah, we don't think so. Based on our experience as your physician. What? Right. Why would you tell me no? My doctor and I did this testing, and my doctor and I made this decision together, and now you're telling me I can't have this? And we don't just see it in minor things sometimes. We see it in some very major things, including life-threatening illnesses, life-threatening situations that insurance companies, I mean, there's lots of stories out there about it, have made the decision not to cover something. And when that happens, of course, the person cannot afford it. Now, does that mean that people shouldn't have health insurance? Well, that is, as the old, if you're old enough, you know what I'm fixing to say here. That's a $64,000 question, right? Right. That used to be a game show, for you younger folks. It used to be a game show, $64,000 question. But it becomes quite a quandary for people because they can be in your situation. And then I tell people something like this, you're like, oh, okay, well, so I'm in great shape not having health insurance. Maybe. As long as something doesn't happen that, and here's the problem, that would require you to have health insurance because no one will treat you otherwise. We also see this situation where some doctors and facilities will not treat someone unless this is not life-threatening, right? But they can choose, right? In other words, I need to have this done. It's very important. It could threaten my life, but it's not an emergency, so they don't have to take you. People say, oh, they have to take you if you're sick. That is not true. If you're not going to die because of it, they don't have to take you. An emergency room does, a hospital does if it's life-threatening, but not if it is a scheduled type thing. Okay.
Okay.
So because of that, there are facilities that will not take you. Why? Because they're worried that they're not going to get paid. Right? I mean, that's a valid reason, right? They're
Sure.
saying, okay, we're not going to get paid.
Right.
Now, at the front end of that, especially if you're going to a nonprofit, say, facility or nonprofit hospital, if you have some type of condition and you obviously are in your low income, you can prove your low income, then there is charity care also available. So there's different routes you can go if you don't have insurance. If you do have insurance, and I recommend if you have insurance, that can be a good thing. I mean, there's certain insurances that work better than others. But there's also alternatives to insurance, such as medical cost sharing, different co-ops that you can be together, association plans. There's things out there that you can join or that you can be part of that you can share cost with other like-minded folks. And then you're still not in insurance, but you're in something you have a little more control over because you're able to really navigate your own health. The good thing about that as well is if you don't know how to, then many of those organizations also provide navigators and advocates for you to help you down that pathway. Because one of the more interesting things about healthcare is that unlike almost everything else, there is no correlation between quality and price. In fact, usually the more you pay, the worse the quality. And the reason for that is because of all the administration that has to go into bigger facilities. Big hospitals have a lot of administration because of Medicare and Medicaid and insurance and all of that. In fact, a crazy statistic is that most big hospitals have 5 administrative people, billing, admin, whatever, 5 for every single bed in that hospital. So you start thinking about that. Oh, these people provide no health care. Think about it. They have no health care, nothing. They provide no health care. All they're doing is increasing the cost. But the hospital cannot function without them because of all the crazy billing that has to happen, all of the different paperwork that has to be done, all the different systems they have to use that have to talk to one another, the connections with physicians, all of those things that have to happen behind the scenes to make anything work properly. All of that has to be done. So the administration is there. What that does on top of that is a lot of times then they cannot bill the way that they should. First of all, there's a lot of underpayment. Whenever those bills go out, they never typically get what the bill was. They always get paid less. But the quality just isn't there a lot of times because of how much emphasis is put on administration. Whereas if you have standalone surgery centers, physicians that do not work for hospitals or physicians that don't work for private equity or that don't work for insurance companies, because now insurance companies are employing physicians. In fact, the more physicians work for United Healthcare than anybody else in the country. That's conflict of interest in my opinion, but there you go. They didn't ask me. But when you go to these facilities that have less overhead, you're typically getting the numbers show you're higher quality, better outcome facilities. And when you're working outside of the insurance world, and many of these don't even take insurance, they're cash pay, or they work with medical cost sharing, or they're doing bundled pricing. And that's also where you can save. So, heaven forbid, Barb, let's just say that you ran into a situation where you had to have a knee replacement. You had done, or we won't even say a knee replacement. We'll say you tore your ACL.
God, let's hope not. I'm a runner. We're knocking on wood right now.
Okay. And so this is a devastating injury to you. Then
Correct.
It would be something you would want 100%. You would want to get corrected because you would say, hey, I can't do what I want to do with this. I've got to have it done. You don't have insurance right now. But the wonderful news is you're like, I don't even know what to do. Who is that crazy guy talking about all this stuff that I had on my podcast? Let me see if he can help me out. So you give me a call and I say, okay, so here's the deal. Where are you located? You tell me where you're located at. I find a surgery center close to you. And I say, here's what we can do. If you went to your local hospital, it would cost you $79,000 for all of your stuff. And that's just going to include the surgery, the physician, and the hospital stay. But, if you'll drive 50 miles to this standalone surgery center that has better scores than what your hospital does, I've got you a bundle for $14,000 to do all your pre stuff, the surgery, the rehab, the physical therapy, all of that complete bundle, cash price, $14,000.
Hey, real quick, let me interrupt and ask you about the scores thing before I forget. Can you just briefly tell me what that is?
Yeah. So there's scores come from various different ways. First of all, unfortunately, a lot of them are self-reported. Yeah. If you had to report on your scores, how well would you say you did? Right?
A plus plus plus.
Yes. However, there are some things that are kept track of by CMS, which is the Center for Medicare, Medicaid, all of that, who takes care of that, where they can see the claims that were put in on particular people anyway. They can see what the results were, right? If someone has to keep being readmitted by things, obviously that's going to bring a hospital score down because they're not doing well. If someone was admitted for a knee problem and then got staph or then was starting to be treated for other things, we know that came from the hospital, not from there. That's going to drag scores down. So there's patient safety. There's things like that. CMS. Leapfrog is another place that we get scores from about patient safety. But there's about 42 different places we can get scores. Many of those, though, that we like the best are independent sources. That we're able to get data, not self-reported, where we're able to get data on claims and on sicknesses and on, most importantly, on outcomes. Those scores of looking at that is how we help you decide, how we help you determine, if you allow us to, where to go and which physicians to see.
Okay.
To kind of get, I'll jump in this to kind of give you how important this can be. One of my colleagues had a good friend living in the Pittsburgh area that unfortunately had a brain tumor. And he was having a conversation with this guy, and he could tell he was real down. And we asked him, man, what's going on? Tell me what's going on. And he told him about the tumor that had been found. And he said, oh, man, I hate to hear that. He says, what's the prognosis? He goes, well, I don't know. You know, they've got to kind of get in there. It's one of those where they can see it, but until they get in there and do something, we don't know what the long-term effects are going to be. And he said, the good news is, you know, I'm right down the road from this hospital here in Pittsburgh. It's a great hospital. And, you know, I'm blessed that I'm going to have the head of that department do my surgery. And my friend said, hey, I mean, that sounds great. Would you like me to at least check that out, though? I can run the scores on this guy and just kind of give you an idea of what his scores look like and make sure he's a good quality physician. He goes, well, he's the head of that department. I'm sure he is, but certainly go ahead. Here's all the information on him. So he ran the scores. A couple of days later, he calls his friend back and he says, hey, I got the scores back. The good news is that hospital has pretty good ratings. I mean, you know, you're in the 80s there. So, you know, you're going to be good. And he said, well, what about my physician? He goes, well, his score was 8.4. He says 8.4.
Not out of 100, was it?
He says, that's not bad. He says, well, that's 8.4 out of 100.
It was out of 100. Holy crap.
And he said, what? He said, here's the problem. You've got the head of the department. He doesn't perform surgery anymore, except to keep up whatever certifications he has. There's a reason physicians call it practicing medicine, because the more they practice, the better they get at it. And what we see, particularly in surgeons, is the more they perform a certain surgery, the better they are at it. So the interesting thing is there was another physician at that hospital that worked for this guy whose scores were 90 in the 90s. His 97 something. I don't remember exactly. I'm like, I want that guy. I don't want the one I picked. I want the other guy. Right.
Right.
You know, this is just what happens. You think, right? This guy is the head of the department. He's got to be the best.
Yeah, you would think so.
Right. How do we get most of our referrals? Most of our referrals is, oh, well, that's the guy who did grandma's knee. Or that's the guy who did, you know, our neighbor's friend's son's knee surgery or whatever. And so that's who we're going to use. but we have no numbers. Oh, let's look at Dr. Google and see what he says.
Yeah, don't do that. And I'm in the Google world. I'm telling you, don't do that.
Yeah, but what we're doing is you're finding out what people thought about the doctor, not what the outcomes were. Oh, he was such a nice guy. Okay.
I don't care about nice for doctors. Like, they can be total pricks if they want to be, as long as they fix what they're supposed to fix.
Exactly.
Yeah.
Typically the best ones are not your friend, right? They're not trying to be your friend. They're just going in there, they're getting it done.
Yep.
Maybe it's a little different with your primary care doctor. You want a primary care doctor that's a little more personable so you can have a conversation with them. But my surgeon, I don't care.
Yeah.
I really don't care. I just want him to be really good at what he does.
So what's the difference between going through a company insurance program or something like that versus this kind of a program?
Yeah, that's a great question, because in many cases, people look at their insurance card that they got from their company as just an unlimited card, right? I mean, my copay is $20, or my copay or my deductible, whatever, and that's all I'll pay. And when you do that, the person paying, or the payer of the rest of it, is typically your company. Okay. So are you wondering why you haven't been getting raises?
Yeah, well, they do have to. Yeah, they have to pay for everybody's, depending on if they get used or not. I do vaguely know that a little bit. So that.
But think about that for a second. If I'm using this, and there are times. So there's two different kind of plans. There's self-funded plans, which means your company truly is paying the bill, or there's fully insured. But either way, if you are not being fiduciary, if you're not really making good decisions about your healthcare, and you're treating your insurance card as an unlimited access to healthcare, and you don't care what the costs are, and you're not really shopping, you're not practicing consumerism like you would for anything else. If you're not doing that, then the rate's going to keep going up. Well, you may not even see that as the employee. In some cases, the company just absorbs that. But when they absorb that, then understand why you're not getting raises every year. You know, your insurance company just got a raise.
Yeah.
But you didn't.
Yeah.
But it's
or they just
people.
Yeah, or they just put it up the next year, because I know that happened to me when I was working in corporate. They would say, "Oh, it's going up a few dollars, so let's relook at all the plans to see if you're on the right one," that kind of thing. So the one that you're mentioning, is that's not one of the like co-op type ones, is it? Like, what's the one that you're mentioning specifically called?
Well, I mean, there's a number of them out there. My company, Eagle Care Health Solutions, we do offer some of those as well. And we offer regular insurance as well. And we do insurance for companies.
Okay.
Not everyone's ready to go down that route.
Right.
We are going to explain all the options for you, and we're going to make sure you understand what's out there. Our goal is to help you control your cost of healthcare. I'm not a traditional insurance person. I am a business consultant. If where you're at is the best place for you to be, then I tell you where you're at is the best place for you to be, but I can still give you some tips on how you may want to design things a little bit differently to help you save some money. I mean, we're even rolling out a program now, which I'm pretty excited about, where you can provide a number of benefits for employees. And we were only able to get this down to 10, so it may not apply to many of your listeners, but if you have 10 or more W-2 employees, so it's not 1099, it's W-2 employees, we can actually provide a number of free healthcare services for your company. I mean, including telemedicine, behavioral health, a number of things, a bunch of different things that you can receive now for no cost whatsoever to either the company or the employee. So there's a lot of great things out there and coming out there. It's taking advantage of certain tax credits and things that are available now that the government is offering, because they really want some smaller businesses, but their idea of small business and ours are a little bit different. But they really want small businesses to have some benefits here. And so they're offering an opportunity for these businesses of 10 W-2 employees or more to start offering some healthcare services. I mean, we're not talking a full-blown catastrophic plan that will cover catastrophic, but some of your more basic day-to-day telemedicine and virtual, and like I said, behavioral health, things like that would actually would be covered 100% with no out-of-pocket cost for the company or the employee. Those are great basics to have. You know, it can be so inexpensive, even for someone such as yourself, Barb, to talk to a physician. You know, I was at the hospital yesterday. Unfortunately, my mom was having surgery, but everything went really well. And I was talking to this young lady that I met there, and she had this weird little growth right by her eye. It almost looked like a sty, but it was on the outside instead of the inside. And she's like, I don't know what to do. She heard my family talking about what I do. And so at first, because of the crazy things I talk about, she thought I was a doctor. I'm like, I'm not a doctor, I promise you. But I said, I've got some ideas of what you could do. What kind of health insurance do you have? She goes, well, this is what I have. And she has an HSA. So when you have an HSA, that means everything's out of pocket until you meet your deductible. So she was hesitant to go to her physician because it's going to cost her a couple $100. It's like, if it's nothing, then I've wasted this money. I said, well, do you have telemedicine? She sat there for a second. She goes, I think I do. So she got her card out and looked at it. She goes, it's $10. It's $10. She goes, and I think I've used it before, but I talked to someone on the phone. I said, well, I'm pretty sure you have a virtual. So she told me the name of the service she has. I said, I guarantee you they have a virtual. These are the little things that you can do to help yourself, because maybe you don't need to go to the doctor, but you can still stay engaged with a physician. And many times those physicians can give you more time in a virtual setting. So that's why I'm so excited about some of these new programs that are going to be zero cost, because it truly gives people access to healthcare without the burden of any type. And in the case of ours, it's not even $10. It's a zero cost for those visits. So you start removing the burden of anything. There's no cost. Remove those barriers, remove that burden, and now all of a sudden people may be more likely to engage in healthcare. To come back to what you started talking about the first, though, about health insurance, I still believe that if you don't have health insurance, you should have something to protect yourself financially. Health insurance is not always that answer, as I mentioned earlier, but here's another shocking statistic, and that is that the number one reason for people to file bankruptcy in the United States is still due to medical debt. But over 50% of those people had health insurance.
Really? That's crazy number.
Yes. So what good is it really doing? This comes right back to what you said. Why would I have it then? It's tough for me to really come up with a good reason why someone would have it. If you got a cancer diagnosis, I don't know that you're going to make it without it, unless once again, you have one of the co-op programs that is able to work on a cash basis. But there are many plans out there in many states that, in particular ACA plans or Obamacare plans, that if you have those plans and you were to get a serious ailment such as cancer, you will most likely not to get to go to the facility that you want to, because those facilities don't accept those insurances. So that's a whole nother issue that we're facing now, is because of the low and slow payment of claims by many insurance plans, especially on the individual market. Many physicians and higher quality locations won't take those insurances anymore. So it's quite the quandary we've put ourselves in, to be quite honest. It is, as someone who's been in this industry for 20 years and has sold a lot of insurance, it was quite an eye-opener to me back in 2017 when I started really realizing what the problem was the dadgum insurance plans. And therefore, me as a representative of those was part of the problem too. So that's when I started really looking into what alternatives are there. And I started finding medical cost sharing and co-op plans and things, and said, okay, well, are these the answer? So I started doing a lot of investigation into those. And I don't know, it's a tough situation, because even with those things, you have to remember that even a medical cost sharing plan is still not health care. Health care is health care.
Right.
And that doesn't change it. Having that access to healthcare and not going bankrupt in your healthcare journey, that is the goal of that's what it should be the goal of any program that you get, whether it's insurance, whether it's medical cost sharing, whatever it is, that should be the goal. But too many times particularly the way insurance companies are built, they're for-profit companies.
Right.
That's what they are.
Yeah.
They're literally for-profit companies. If you're for-profit, what is your main goal? For profit.
Right.
And you're not designed around the patient, you're designed around the shareholder. They have to make the shareholders happy, not the patients happy. And what we look to do with the innovative things that we put together is to put the patient first. There's another thing we haven't really talked about yet called direct primary care that we're huge proponents of.
And what is that?
Direct primary care is a membership-based model for your primary care. So most people's experience in traditional health system now with their primary care physician working for private equity, hospital system, or insurance company is that they get about 5 to 7 minutes per visit with their primary care physician. In that visit, the more likely things to happen is that your physician, if you're coming in for some kind of issue, your physician is going to give you another medication, or they're going to refer you to a specialist because they don't have time to treat whatever you have going on.
Yep. I don't have experience with that because I never go in, but that's what I hear when my friends talk about going to their doctor. Yeah.
Yeah. So there you go. So why do I do that? Okay. So you're sitting there saying, and this is why I don't go, right?
Yeah.
What? I'm going to go and they're going to tell me something. Okay. You said you're a runner. You're probably in really good shape. You take good care of yourself. You eat well. I'm going to go to the doctor and they're going to find something so that they can send me to the pharmacy to pick up a prescription. Or they're going to say, oh, this is elevated or this. You need to go see this specialist. Well, let me drop the other shoe now. In most cases, they have quotas they have to meet in referring to specialists up the hospital chain.
I did hear that.
Or they have already met their quota and now they're working on a bonus.
Okay. I did hear something about that. And also I heard about that was there was a big to-do when prescription drugs went direct to consumer. And that's why, the commercials and stuff, I mean, it wasn't like that, 20, 30 years, whatever. It was forever ago.
Right.
You didn't see them on commercials. And then all of a sudden you saw them on commercials all the time because then doctors were pushing it because they would get pushback from the sales associates from the pharmaceutical companies. And I don't know if I necessarily want to go down that whole route, but I do. That makes sense now when you were talking about that.
Well, the interesting part of that is they changed the law on what they could receive back from pharmaceutical companies. They changed the law a number of years ago in 2008, 2007, 2008, somewhere right in that. And I mean, they used to get trips to Cancun and cruises and I mean, all kinds of great kickbacks that the pharmaceutical companies could give them.
Right.
Now, instead, what they get is they get hired as consultants by the pharmaceutical companies to have separate jobs. They get other little jobs, real jobs that they're paid for by different pharmaceutical companies. They make it on panels or they get other little perks.
So it's a conflict of interest still though, right?
No, we're not talking about every physician, okay? We're certainly not talking about every physician, but there are other times. So here's something else to remember. Okay, we're going to go a little bit down the rabbit hole here, but you open the door, dadgummit. All right, so if a physician works for someone like United Healthcare, which is the largest employer of physicians in the company, United Healthcare also owns a PBM. A PBM is a pharmacy benefit manager that negotiates with the manufacturers of medications on what the prices are. Depending on the medication and the pharmacy used, there is a legal kickback called the spread that the PBM gets. So if I am your employer and I know that I get a bigger kickback on medication, I'm just using an example here, folks. I get a bigger kickback on high blood pressure medication losartan versus the high blood pressure medication lisinopril, then I am going to tell you that we're seeing better outcomes, wink, wink, nudge, nudge, with losartan for our high blood pressure. So we recommend, Mr. Physician, that when your folks come in with this issue, that you write this prescription. Okay?
Yep.
We're also, every time you write so many, we're going to give you a bonus. This is not now from the pharmaceutical manufacturer. This is from your employer. And your employer has the right to provide bonuses based on certain incentives. It's just a moving of the game, right? It's just changing the way that they do things. Well, now back to direct primary care. What does that look like different from this model? Well, first of all, they work for themselves. These are your old-timey physicians, are physicians that have come out and been in this system and said, to heck with this, I can't work this way. It's the moral bankruptcy of our primary care physicians. And they started their own practice with a membership base where you pay a monthly fee of, let's just say $70, and you can go as many times as you want to. You can text them or call them if you have a problem, and really engage with you and build a relationship with you so that you actually receive the best care possible. Now, this is vitally important in not getting referred out to other doctors that you don't need to see, because a primary care physician typically can handle 80, depending on the levels of their training, 80 to 90% of whatever ails you. They're obviously not hospitalists, but they're not going to just send you. If you have diabetes, typically you're not going to an endo. They don't need to send you to an endo. They can take care of that. Thyroid issues, typically they can take care of it. They don't need to send you to an endo. There's a cardiologist. It's going to have to be pretty serious before they send you a car. They can take care of those things. They're trained to take care of those things. And then if for whatever reason you do need that referral, then most cases, they have built a network of friends and compatriots there that they can refer you to someone who is a cash pay, give you the best quality, and also not bankrupt you. And you're not spending $1,000 a month on a health insurance plan that maybe you don't even go to the doctor. So you spent thousands and thousands of dollars and you haven't used it.
Yes, that was my problem. Well, not a problem, I guess that's a wrong word, but that was what always drove me nuts. Like I would have this thing I was paying for, but I never used it because I didn't have to go in. So if we are a freelancer type and we don't have somewhere to go for insurance, or we don't have the spouse to go through or whatnot, what do you recommend someone does, or how do they manage healthcare or the options for insurance if they had to go do something that was, say, a colonoscopy or something else as you're getting older that you're supposed to have?
Right. Well, so we talked a little bit about Obamacare earlier, and that is not a bad option for catastrophic care. And the good news is when you have those type plans, mammograms, colonoscopies, the two higher cost things that you are supposed to have. Women, of course, we're talking about every year for that. And then depending on your medical history, colonoscopy, 5 to 10 years, those are free. So those are considered preventative care services. And if you have an Obamacare plan, which typically for gig workers, freelancers, you can get those very inexpensive or even zero cost. Even if you have a zero cost bronze plan with a $9,000 deductible, those services is preventative or zero cost. So that's a beautiful thing.
Okay.
Now, your day-to-day is what you're most likely going to spend money on, though, if you don't have one of those. And now we're back to direct primary care and one of those type programs. In my opinion, because of as healthy as you are, Barb, if I was able to find you a direct primary care physician in your area, and maybe there's a few of them, and you were able to talk to them, interview them, as it were, to kind of give them a little background on you, to find out if any of those were a good fit for you, that would be the best spend of your money. Your healthcare spend going towards that, knowing that you had a physician that was going to talk to you about your lifestyle, talk to you about you, not a generalization of, well, Barb, people, females in this age group all
just eat right and do exercise.
Stop right there, Doc. When you just said people in this age group all, you just lost me, because that is a generalization and we're not talking about me anymore.
True.
What we need to talk about is me. And so if we're having a conversation about me, that's what we need to do, because I am not like the person who just walked out of here. Maybe we're 80% alike, but that other 20% can be the difference in the treatment of me and the way that what you recommend for me than what it was for that person right there. Right. So that's what's important but because of that extra time you get with direct primary care, they're literally able to customize whatever treatment. If maybe there's nothing, you know what? It's funny. I hadn't been to the doctor in a while either. Okay. Even though I got direct, I hadn't been. In fact, it had been 2019 before I went to the doctor last year. I got a new direct primary care doctor, and my wife was just on me. You got to go. You got to go. You got to go. You're
Right.
50 at the time, 56 years old. You got to go to the doctor. You ain't been in years. She's on me. I'm like, all right.
Yeah.
And she's expecting all these things to be wrong with me, right? She's like, you've got, and there was nothing. She's like, it's like, I'm like, hey,
That's great.
I kind of know me. I mean, if there was something
Yeah.
wrong, I think I'd go to I think I would. I'm a guy though, so maybe I wouldn't, right? But my whole point is I got my direct primary care doctor. Our very first visit actually was a virtual visit. Before I came to see her personally, I met her virtually, which is pretty cool. So we get on a call just like this. She gets on. She goes, "Hi, I'm Michelle." Not I'm Dr. Reddit. No, I'm Michelle. And we just had, for the first 20 minutes of our visit, we were on for about 45-ish minutes. The first 20 minutes was just getting to know each other. Just ask me about me, are you married? You have any kids? Where are you at? Part of town as far, that kind of stuff. Now, let me tell you something interesting. Because I kind of work in this industry, I knew what she was doing. All of that information should be very important to your doctor.
Mm-hmm.
Knowing your living conditions. So I'm married. I have a son that's married and lives about 5 hours away now. I have a daughter that goes to college here in town, but she lives on campus. She comes home on the weekends. I've been married for 33 years. We're talking all these things. I have 2 pets. We talk about dogs. We talk about all these kind of things. What she's going to have in her mind about me is going to be different if I said, well, yeah, I've been divorced for about 3 years. I'm living in an apartment by myself. Yeah, I know I drink too much. I hadn't smoked for a few years, but after the divorce, I found myself smoking again. And I go down this pathway. What's going on in your surroundings and what is going on in your life has now changed some of the questions she's going to ask, and maybe even some of the tests that she's going to have recommended run.
Right.
Okay.
Yep.
But if the doctor doesn't know anything about you, because they're not having that conversation with you, because they only have 5 to 7 minutes, good luck, doc, and never figuring out anything about me. This is why I love direct primary care.
Okay.
It has been great for us. It has been great for my family. My son and daughter-in-law have direct primary care doctor where they live. My wife and my daughter have direct primary care. It has made a huge impact on our lives as well. It's kind of a funny thing back to insurance. We haven't had insurance since 2019 because we use direct primary care and we also use medical cost sharing. So no insurance because we found alternatives that work better for us.
Yeah.
That
So
doesn't
you do
mean
both. Is that right?
Correct.
So you do both? Okay.
Correct.
So you
because
can do
direct
both.
primary care is for day to day. Medical
Okay.
cost sharing is for the big stuff.
Gotcha. Okay.
Right? If something, so I've got a couple of bad shoulders. Whenever I went through the process of looking at getting rotator cuff surgery, it turns out both of them are so bad that I need to have shoulder replacement.
Oh, no.
But the interesting thing, once again, you go to a high quality doctor that you're paying cash for. He said, but I don't recommend you do that. I said, really? He's like, yeah. He said, I think we should give you a couple of shots just to kind of help you. He said, you ain't going to tear them up any worse. You've already done that. Okay. You've already messed them up so bad that you need replacement. We can't repair it, but you're too young to have it done.
Really?
Well, first time I've heard that in a while. Appreciate that, doc.
I didn't think you could associate age with something like that to get something replaced. I mean, if it needs replaced, it needs replaced.
But here's the deal. Here's why I said I was too young. Because unlike knees and hips, shoulders are used so much more that typically I would have had to have it done again in another 10 to 12 years.
Oh.
So when he said I was too young, he said and now I'm 57. He said at 57, You doing this means that you're going to have it done again at 67, 69.
Mm-hmm.
So what I would recommend is, once again, you can't tear them up. I'm not having, once I've had a couple of shots in there, I'm not having the same issues. I can raise my arms better, my right one better than my left, but I'm not having some of the same issues that I was having. And I'm certainly not having any pain. She said, if we can get you through for about 5 years, then we do the replacement. Not because I'm saying you're going to die at 70, but because as you get older, you're not going to use your shoulders as much. You're not going to, so the length that they're going to last
you off at a certain age, and he was thinking, oh, you're only going to need one replacement versus two.
But that was the whole thing, right? He's like, if you replace it now, and he's thinking, and I get this, 10 years from now, what's your health going to be like overall? Will you be one of those people that is just in great health until you're in your 70s? Or 10 years from now, will you have other things going on that maybe it's going to be hard for us to even do it, or harder for your recovery? So the chances are that 5 years from now, I'll be in better, health shape than I will be in 10 years or 12 years from now.
Sure.
And he left it up to me. He said, hey, man, I'll get paid to do it. So if you want me to do it, I'll do it.
Yeah.
But it's your choice. But when he explained it to me the way he did it, once again, he wasn't saying I won't do it. He was giving me the choice.
Okay.
To me, it makes sense. To me, that's logical.
Yeah.
But the difference, what I'm trying to explain here is that if you go to a physician, that the only way they're really going to get paid by the insurance company is if they perform surgery. And they're out there, folks. There's plenty of them out there. It's the only way they make money. Their answer is always going to be surgery. It just is.
Yeah.
That's the end goal. Remember, we talked earlier about primary care physicians that are paid bonuses to refer to specialists. Well, those specialists get referred to refer you to surgeons.
Yeah.
And those surgeons get paid to do surgery. That's what they get paid for, right? To do surgery. So the end goal is procedures and surgery. That's the end goal for whenever you start getting pushed up that ladder. They make more money that way. I'm not saying it's good. It's just the way it is. But your direct primary care that works for themselves, they have no other incentive except for you. Their practice is built around their patients. If you're unhappy, you're leaving.
Yeah.
If you are happy, word of mouth is typically how most of them build their practices. You're going to tell your friends, it has been such a wonderful experience. And then all of a sudden your friends that are seeing a traditional doctor or can't see their doctor or have to wait 4 months to see their doctor say, you know what, forget this. I'm going over here.
Yeah.
And that's what we're seeing. I mean, we have a number of people, folks that are gig workers, folks that are small businesses, only have one or two, maybe it's a husband and wife, whatever, that have an ACA plan, have an Obamacare plan for their catastrophic and have their day-to-days taken care of by direct primary care because they have complete access to their doctor, same day, next day appointments, no long waits. When your doctor tells you I can get you in next week and, your feet, you feel like death warmed over and, I can get you in next week. Well, doc, I'll be dead or well by then. So thanks anyway. I appreciate it.
Yeah.
And then you head to the ER or whatever. And then, you get a $2,500 bill when if your doctor would have seen you, he could have gave you a Z-Pack and away you'd have been or whatever was going on with you. Right. But it's just a difference in access to healthcare. And that's what direct primary care does. No insurance involved. Direct primary care allows you access to healthcare, can take care of most of the things going on with you. I mean, to me, it's kind of a no-brainer. It changed my whole outlook when I learned about that and learned about medical cost sharing. I said, what is this crazy insurance thing that I've been doing for all these years? And once again, still do. Not everyone's ready for this jump. Some people got to have Blue Cross Blue Shield. Some people got to have United Healthcare. Some people got to have whatever. They've got to have it. Then I'm going to help them and just have them set a little reminders of all this, of the better way that's out there as well. Because I personally believe it's a better way. It helps you gain control of your healthcare journey.
I like that. Oh, this was such good information, Harlan. This gives me I guess, a little bit of hope that there is like a solution somehow, some way that I can look into and just feel better about like that side of my business, that side of my personal area. So I want to wrap up and ask you, from all of that, there's so much good information. What do you feel like is like the best takeaway that someone can take away from today's episode?
Just because this is not pointed at you, but you're going to feel like it's pointed at you.
Okay, do it.
Just because you're healthy and don't have any problems does not mean you should not take care of yourself and see a physician and make sure that everything is okay.
Mm-hmm.
Every single person that is getting a bad diagnosis today felt like they were healthy at some point, maybe even today. Maybe they're even going in and thinking that their blood work is going to be perfectly fine, and they're going to get told something that shocks them. And the earlier they catch something, the better off they are. Both of my parents have had cancer in the last year. Both of them were caught in stage 1, and both of them have great prognosis because of that. Both of them have full recovery, no major treatments because it was caught early. Preventative medicine is huge. And the best way to receive that preventative medicine, in my case right now, is my belief, is through direct primary care. So if all you can do is spend just a little bit each month on your health, then I would certainly look at direct primary care in your area, or, feel free to reach out to me and we can help connect you with a direct primary care physician in your area as well. That's what we do all day long. No, we don't get paid for it, but we believe in it so much that we want to connect you with that right physician. One other thing is we do build health plans, actual true insurance health plans that are independent and not with any of the big carriers around direct primary care as well. One of those plans that we build, you even have access to all of your other services. If your direct primary care says you need to see a specialist, and then that does turn into even medications and surgeries, then all of that is zero cost to the actual patient. So we can build specialized plans like that are going to send you to high quality places. There's great, what do you take away? You don't have to have traditional health insurance to get great health care. There are alternatives out there, and there's not a lot of people. There's less than 500 folks that do things like I do around the country, but there are some of us out there, and we help people all over this country every single day.
Thank you for this. And if somebody wanted to contact you for more information about what you do and how you can help them, what's the best way they can find you?
Yeah, they can connect with me on LinkedIn if they want to, Harlan Pickett. It's very easy to connect there, or you can go out to our website. It's eaglecarehealth.com, eaglecarehealth.com. You can reach out to me there. There's phone numbers there, emails there. I got a whole team behind me that will send you my way, or maybe help you themselves if they can. I think we even have a new chat feature on the website, so you can chat if you want to.
Very fun. All right. Well, thank you so much for your time today, Harlan. I really appreciate it, the enlightenment. Thank you.
You're very welcome, Barb. Thank you for having me on.
All right. And that wraps up this episode on healthcare insurance for your small business. Stay tuned for more episodes to help your business thrive online. We'll see you in the next sweet spot. Cheers. Thank you for sticking around. I hope you enjoyed the episode. If you're looking for SEO and content marketing help, you can find all kinds of information at compassdigitalstrategies.com. And if you like the episode, please tell a friend. Cheers.